Hello, and thank you for joining me to hear my concerns regarding the delivery of mental health services in Pima County, Arizona for children, adolescents, and their families. My concerns derive from four perspectives. First, as a parent of four adult children. Second, as a board-certified psychiatrist, having worked for 34 years almost exclusively with emotionally, behaviorally, and mentally ill children, adolescents, and their families. Third, as an ordained vocational deacon in the Episcopal Diocese of Arizona. And fourth, as a concerned citizen of the town of Marana, Arizona. During my career in each of these four areas, I have seen a steady decrease in the quality and quantity of mental health services for our youth. This has been a period also in our history which has seen a decline in the central role of an intact, consistent family environment. Also, there has been increased tension within and between all components of delivery of care, including physicians, psychologists, social workers, insurance companies, legislators, schools, and even families. This has resulted in not only a decrease in the availability of services, but also far too often a fragmentation in the delivery of care. I have experienced during my 8 years in Arizona what I believe to be a serious flaw in the political and public money managers' approach to these problems. I sense a failure in discernment between a bad kid, of which in my opinion there are very few, and a good kid who does a bad thing. Kids speak in behavior, and only as verbal skills mature do we speak more in words than behavior, although who among we adults hasn't slammed a door or suddenly withdrawn in response to hurt, anger, frustration, feeling misunderstood, or in fear. It seems to me all bad behavior by a child or adolescent is predominantly responded to as having been committed by a bad kid, and much too often the intervention is not designed to understand what the child is saying in behavior, but rather directed at punishing the surface behavior beyond the assignment of appropriate consequences to, quote, fit the crime. Kids are very vulnerable, especially to poor peer pressure. Also, the first stage of learning a new skill, be it adaptive or maladaptive, being a good student or being a drug pusher, the first stage of learning a new skill is by imitation. With practice, such as learning to ride a bicycle, or stealing cars, the skill becomes internalized. That is, it becomes a part of our innate skills. My concern here then is that kids are too often thrown together in a juvenile justice system where they are vulnerable to having reinforced their badness. Too often the needs of the total child, their physical, educational, family, vocational, recreational, and even spiritual needs are not able to be met or are met in minimal proportions to the child's development. Should a child or adolescent in Pima County need outpatient mental health care, some is available, as is very short-term acute hospital care for a child who is considered to be dangerous to himself or someone else. Partial or day hospitalization is woefully unavailable, although it is often the placement of choice, allowing the child to live at home or in another appropriate setting while getting necessary therapies. Sadly, because of very measured political efforts, no residential or extended hospital care is available in Pima County. Kids needing such care are sent away to Phoenix, Sierra Vista, or even out of state. In my opinion, mental health services for the emotionally ill or behaviorally disturbed children, adolescents, and their families is being politically and dollar-driven. What do I suggest as a solution? First and foremost, a cessation of finger-pointing and blaming, both of which are often sensationalized by local written and visual media, whose passion and commitment appears to be first and foremost to be politically correct. This is not just a problem for Child Protective Services, or Keno Hospital, or insurance companies, or Dr. King, or any other provider of services, or provider of fiscal resources for youngsters in need. It is a problem we all must take on. Providers, caregivers, insurance companies, state funding agencies, and private citizens alike. If dramatic steps are not taken, what do I think from my four perspectives will result? Youth and family casualties will continue to rise in all forms. Kids treated as bad kids will become bad adults, and we will need even more adult prisons. Comprehensive mental health services for children, adolescents, and their families must improve in quantity, quality, and availability. I am the Reverend Joe W. King, MD, and I thank you for listening to my commentary.